It would appear to me that the TGA is like so many other organizations. They have a misunderstanding of who's the real customer. And it would be normal to think that doctors are the customers, or device manufacturers are the customers, or pharmaceutical companies. But actually, the real customer is the patient. And even if the patient is not paying out of their pocket, the majority of it, we are, as payers of taxes, paying for it. And so collectively, we as patients should be really demanding more transparency from the TGA about how they go about these things. I saw a 730 report on the implant files a couple of years back, and one of the cases was a guy named Wolfgang who got a shoulder implant that was approved in Europe, but wasn't approved in the United States. The TGA had based their approval, it would seem, on the European approvals and not on a more comprehensive view. And in fact, if you go look at the TGA's video for consumers, which is in their website or available through YouTube, it says we cannot check everything. And I understand that, but there are certain things that are higher risk than others and need more checking. And if it's the case that they don't have the resources, which I'm afraid is probably the case, then we as taxpayers need to be putting more resources into that versus paying for Mrs. Smith to get her breast implant removed because she's gotten cancer from it, or Mr. Jones or myself having the implant removed because it's bad material. So we would save a whole lot more money by doing more preventative medicine and investing in TGA work and proper work versus simply rubber stamping.